Hi, I'm Dr. Kim Duramo from drkimduramo.com. I'm a board-certified osteopathic physician who helps stressed professionals have the body, the energy, and the lifestyle they really want. And this is a video I've done specifically for doctors and healthcare professionals to assist their patients in a self-healing technique called EFT meridian tapping. EFT stands for Emotional Freedom Technique, and I've done an intro video to introduce you to some of the concepts behind this, how it works and why it works, and how you begin to use this with your patients. Now, the first step when you begin to use EFT tapping, you've got to learn where the meridian points are, and I'm going to teach them to you in this video. There's also a map of the meridian points on my website at drkimduramo.com that you can go ahead and look at to find. You want to start with a setup phrase, and you're going to use the karate chop point for that. And the tapping is just a gentle percussion. You use the tips of your finger on the areas that I'm going to show you to tap. And you could use your right hand tapping on the left side of the karate chop point, or you can use your left hand to tap on your right, or you can even just bring them both together. And if you're driving your car and you want to tap, you can just gently tap your karate chop point right onto your steering wheel. You just want to get some percussion over these acupressure meridian points to re-pattern and change the information coming in to your nervous system. The next point is in the inner eye, right on the ridge of your brow, the inner eyebrow. And you could use one side, you can use both sides at the same time, it doesn't matter. That's your second point. These are all central points, central tapping points now. And the next point is on the outer edge of your eye, right on the bony ridge, on the outer eye, outside the edge of your eyebrow. Next point is going to be right underneath the eye. And again, you could do both sides, you can do one side, right on the orbital rim. And then the next point is right underneath the nose, just above the upper lip. And then the next point is right on the chin. And then you move to just underneath the collarbones. And if you use a few fingers, you'll kind of get the whole general area. And then we go right underneath the arm, just at the mid-axillary line, right at the nipple line, and then right in the middle of the head. So those are all the central meridian tapping points. When you use your karate chop point, we're going to do that for our setup, and then we're going to do all of the main points for the trigger, and I'll explain exactly what that means. We're going to take an issue that you're having or that you're using with your patient, and this is called the MPI, the most pressing issue. Now, if you're stressed, you can just use stress. If your husband's driving you crazy, you can use any of the specifics that might be coming up in your life around money or, relationships or illness and symptoms. So whatever it is, it's a distinct, uncomfortable feeling that you feel in the body, and we can address the nervous system in order to change how we relate and how we experience that circumstance. That's why meridian tapping works, not just for health-related issues, but for issues that are causing us stress in our lifestyle. So in this instance, you're going to use it for your patient who's having a symptom. So let's say they're having some pain, and that pain's driving them crazy. You want to look for any emotions that are underneath the experience of that pain. So when you do the first round of tapping, you might just have them tap just on the pain, the location, the quality, the type of pain and the sensation they're having, how long this pain has been going on. And as they do that first round, even if they weren't aware of any emotions associated with it, the emotions will begin to come up. But on the front end, you might be able to elicit that the patient's really frustrated about this pain. Or maybe they had a traumatic event and they're angry about someone did something to them. So there's anger associated with this pain. A lot of times, especially with chronic pain, there's a powerlessness and a fear that's associated with that pain. Now, the way the brain works, that fear actually keeps your body in a sympathetic nervous system stimulation, the fight or flight stress response, every time the patient thinks about or feels that pain. It will trigger their stress, it will trigger their fear, and as we know, anything that triggers the sympathetic nervous system is going to impair the healing response in the body. So you want to be able to decouple the memory, the thought, the idea, or the association of that pain and the emotions that go with it. You want to decouple that from the stress response, because now they can feel the pain or think about the pain and still stay in a calm state, which is the parasympathetic nervous system, which can initiate the relaxation response and speed healing. So you can use this for any type of pain, any type of stress, or any type of symptom the patient's having. Phenomenal ways I found to use this in medicine are for, like we talked about, pain, chronic and acute pain, anxiety and depression. Usually patients will have immediate relief of anxiety and depression. Chronic illness or symptoms, chronic symptoms that they're having related to an illness. Trauma, traumatic memories, past history of a trauma, any level of trauma that they've experienced. Maybe it's just emotional trauma and there wasn't physical trauma. Those still can cause an illness in the body. So those will be really amenable to treatment with EFT. General stress, which, who doesn't come to your office that isn't having some degree of stress, even just stress about being in your office? No offense. A pre and post procedure. Before you do a procedure on someone, I guarantee you there are levels of anxiety about having the procedure or just pain that they're in that you can release before you do the procedure to have a better outcome and a better procedural experience for you both. And then post procedure to accelerate healing. You can use this for patients to learn on their own to do self-treatment in between visits with you. And this will diminish their need to rely on you for pain management or for other symptoms they're dealing with. You can use this to augment medications or other treatments that patients are on. So if you're an osteopathic doctor and you're using OMT, osteopathic manipulative treatment, you can augment what you're doing for the patient, or even if you're using just pharmacotherapy in general medicine, you can augment the impact of that medication and its ability to reverse symptoms and disease by using EFT tapping and teaching the patient to use EFT tapping along with their medications. And the last piece is to eliminate side effects of medications. This is especially powerful in chemotherapy, where there are a lot of really powerful side effects that happen. This can immediately reverse that. The nausea and other stress responses that happen in the body, you can reverse side effects of medications or other treatments that you may be, that your patient may be on. So how do we start? We are going to find the most pressing issue and begin to tap on that. So let's say it's stress, and we'll do a round of tapping for general stress. You can have your patient rate that level of stress or that whatever experience they're having on a scale of 1 to 10. 10 being very, very severe and 1 being, I don't even notice this at all. So let's say they start out at a 10 out of 10. You're gonna aim to get that level down. May need a few rounds of tapping, and sometimes they might bring up more stuff through the first round of tapping. That is actually a good thing, so don't worry if the level goes up. You start first on the karate chop point, and you just have the patient repeat after you. So in this case, I'm gonna have you tap your karate chop point and repeat after me. Even though I have all of this stress, and this is the reversal, I'm just gonna choose to embrace this experience. And we do this 3 times. Even though I have so much stress right now, I'm gonna choose to love myself and let my body heal. And now the third one. Even though I have so much stress, I'm gonna embrace this experience and allow my body to heal. Great. Now that was your setup phrase. You do 3 times on the karate chop point, the trigger, and then a release phrase. Now you're gonna go to the general points on the body. The first one is in the inner eyebrow. You can use both hands, you can use one hand, it doesn't matter. And now this is just the trigger. All of this stress that I'm having, and then go ahead and repeat. Now the outer eye, right on the bony ridge. This is absolutely driving me crazy. Under the eye. I don't know what to do about all this stress. Under the nose. Everything I've tried has not worked. Right on the chin. And I'm getting worse and worse as time goes by. And now right underneath the collarbone and the inner aspect of your collarbone, all the stress I've been dealing with in my life. And then underneath the arm, right at the nipple line, this is just mid-axillary line. You're just gonna tap right on that point. All the stress I've been dealing with in my life. And then the top of the head. It is wreaking havoc on my body and my health. And now you're gonna inhale through the nose and exhale. The breathing is a really important part because it resets your nervous system and it also repletes your energy. That was one round of tapping, and now you want to reevaluate. Okay, from a scale of 1 to 10, how severe are you feeling your stress right now? And you may have something that's gone on for you and you've tapped on your own stress and you've tapped on your own points now. So how are you feeling? Is there a greater sense of relaxation? When you think about your stress, does it trigger as much of a contraction in your body, or maybe it doesn't trigger so much emotion and you're feeling a little bit lighter around it? We're gonna do one more round. Come into the inner eye. I don't know how I'm gonna deal with all this stress. And the outer eye. And all of the problems in my life. Under the eye. These are really serious health problems. Under the nose. And my body is in so much pain. On the chin. There's emotional pain and distress. On the collarbone. And I don't know what I'm gonna do. Under the arm. And I know this is not good for my cells. In the top of the head. And I'm just gonna allow all of this to be whatever it is. Inhale through the nose. And then exhale. Now you want to check in with your patient. Did more thoughts, ideas, emotions, other things come up during the tapping? Almost always what you'll see is stuff they didn't even remember will occur to them, or a past incident that initiated this problem will come up, or there's all kinds of emotions that come up, or other things that are underlying that pain or that initial symptom that now you'll begin to see. That's the most important thing to address, because all of those underlying beliefs, thoughts, ideas, all of that they're carrying in their mind have been wreaking havoc on their cells. You want to turn that off and decouple it at the level of the amygdala, where the fight or flight response is triggered, so they're no longer constantly firing off all this stress on the body. The last part of this is optional, but once you get your patient down to a level 4 out of 10 or even below, you can begin to tap in an affirmative way. So what you're gonna do here is just begin to put in some good thoughts, good ideas, and good feeling emotions, and to give the nervous system this information. So let's start on the inner eye. I honor and trust my body. And the outer eye. And I allow my body to heal now. Under the eye. Anytime I feel stressed, I know I can let it go. Under the nose. And that my body will take care of me. Right on the chin. I'm learning new ways to take care of and nurture myself. Under the collarbone. And whenever I feel symptoms come up, I can gently tap on my body to release them. Under the arm. I can have a whole new relationship with my body and with these symptoms. On the top of the head. I have the power to live and experience the life and health I want. Inhale through the nose. And release. That was great. Now, as doctors, you're gonna see huge transformation in your patients. Sometimes it's a little intimidating to deal with all of the big things that people bring to you as a doctor, all of the problems and all the things they want you to solve. And what you'll begin to see with this is that you can empower your patient to release all the chaos going on within them so that they can get answers, so that the treatments you're doing will work powerfully, and so that they live an empowered life without all that chaos, without all those layers and layers of fear that can confuse them and confuse you. I hope this is a very helpful tool for you to begin using in your practice, and that you can put a comment below this video, and I'd love to address your questions or assist you with any support that you need in incorporating this into your practice. I've put together a series of videos. It's a training just for physicians to train you to use this in your practice and use it on yourself to enhance the outcomes that you're getting in your practice. If you would like more information on how you can use this program right now, begin using it for yourself and to dramatically enhance the results you're getting in your practice, just come to drkimduramo.com for more information, and I will be happy to share this opportunity with you. This is Dr. Kim Duramo. You can find me at drkimduramo.com. Be well and have an amazing day.